Hello everyone, welcome to our seminar. My name is Emily Clyde. I'm the wellness educator for Lake Charles Memorial Hospital. Just a quick little background about me before we get started. I'm a Southwest Louisiana native, so I'm from this area. I did my undergraduate and master's degree at Acme State University. Also completed my dietetic internship to become a registered dietitian. In the past 2 months, I've met a lot of people so far, but due to our current circumstances, there's a lot of people I haven't met yet. So I look forward to meeting those Memorial employees that I haven't had the opportunity to meet yet. So boosting and strengthening our immune system has always been a popular topic, especially during this time. So today we're going to be discussing nutrition related to strengthening our immune system. So here we go, we can get started. Appetite for immunity. Just a basic definition of what the immune system is. So the immune system is a network of cells and proteins that defend the body against infection. This system contains numerous cell types that either circulate throughout the body or reside in a particular tissue. Many of us have seen certain health products, whether it's a supplement, food, or certain diet, with marketing claims of supercharging or boosting our immunity. I wanted to discuss this particular topic after defining what the immune system is, because the immune system is a complex system involving many cells and organs, and it's not a single entity. So our immune system isn't able to be directly boosted by the consumption of a certain product. The term supercharging or boosting implies the immune system is functioning at a higher level than normal. If you think about it, this is actually not something we would want. Overactive immune function occurs in autoimmune conditions, which is where the body attacks its own healthy tissues. So with that being said, there is no special diet or supplement that's going to directly supercharge or boost your immunity, despite what marketing claims may be labeled on certain health products. So instead, what we want to do is support our immune system so that it can function to the best of its ability, so that it can function normally and do the amazing things that it does for us on a day-to-day basis. So how can you support your immune system so that it can better support you? So from a nutritional, dietary standpoint, focusing on nutrient-dense foods. These are the foods that provide the most micronutrients. They're packed with vitamins and minerals, and maintaining good gut microflora. So eating to support the immune system. A large amount of our body's immune cells are located and reside within our gut, which is our intestine. Gut microbiota is made up and populated by trillions of bacteria and other microbes. Our gut microbiota plays a large role in the strength of our immune system. One of the factors that shape your gut microbiota is the food that you eat, specifically foods and probiotics and prebiotics. And I wanted to mention here that there's many other factors that influence our gut microbiota. So things like age, genetics, medications you're on, and also antibiotic use in combination with our diet. So probiotics, which are the actual good gut bacteria. So these are the active cultures that are naturally found in the intestine. These help change and repopulate the intestinal bacteria to balance our gut flora. Prebiotics are the promoters of the good bacteria. These are fiber-containing foods that the good gut bacteria survive and thrive off of. So in the little graphic to the right, you can see that the probiotic actual live bacteria is thriving and living off of that prebiotic. So, and I also wanted to mention limiting the intake of alcohol, added sugars, and highly processed foods. These can have a negative impact on our gut microbiota. Sources. So probiotic sources will contain live cultures such as lactobacilli. These include fermented non-dairy and dairy foods. So these include yogurt, kefir, aged cheeses, non-dairy yogurt, sauerkraut, and some others that aren't mentioned here. Prebiotic sources are those high fibrous foods, so fruits, vegetables, and whole grain foods such as bananas, onions, garlic, leeks, asparagus, artichokes, and beans. So micronutrient intake. So today we have a focus of vitamin C, vitamin D, and zinc due to their immunity roles in relation to infection. But I wanted to emphasize that these are not the only vitamins and minerals that play a role in our immunity. So there's many other nutrients that have some type of role in our immune function. So protein, vitamin A, vitamin E, for example, have a very important role in skin and tissue formation. And then many other vitamins and minerals play a role too. Also wanted to emphasize before we go on that vitamins and minerals, tend to be better absorbed from food sources. For those that just say, well, I need these 3 vitamins, so let me just go get mega doses of those, they actually are better absorbed via food sources. Too much of a vitamin is not necessarily better. So like I said, mega dosing on those vitamins aren't the way to go. No evidence has shown that excess doses of these nutrients are actually better. So try adhering to the recommended dietary allowances. So we're going to be going over those amounts too. So vitamin C, ascorbic acid, is important for many functions in the body. Synthesis of collagen, it's an antioxidant that fights free radicals within the body, enhances iron absorption. Its role in immunity specifically is forming healthy skin and connective tissue and helping to block the entry of foreign microbes. So the RDA for 19 years and older is 75 to 90 milligrams per day. And individuals who smoke require an additional 35 milligrams per day. And I also wanted to mention that the body is unable to synthesize vitamin C by itself, so we must include it in our diet. Also wanted to mention that vitamin C is a water-soluble vitamin, so what our body does is whenever we ingest vitamin C, it takes what it needs from it, and then the rest is going to be excreted as urine. So megadosing on vitamin C per se is actually almost kind of wasteful in a sense to be megadosing it, because our body's going to take what it needs and the rest is going to be excreted as waste. So research shows, despite vitamin C being known as the long cure of preventing a cold, everything like that, research shows that it does not reduce the risk of getting a cold. However, research does support that it influences the duration, so it can make the cold be shorter, and it may have a effect on the severity of your symptoms, so it may have milder symptoms. Research also shows that vitamin C deficient individuals have been associated with a decreased ability to ward off infection. This is a table with the list of vitamin C food sources, so listed in descending order, starting with red bell pepper, the milligrams per serving amount, and then the right is the percent daily value, so how much that serving provides us with vitamin C per day. So red bell pepper being the highest concentrated source, orange, kiwi fruit, green bell pepper, broccoli, strawberries, Brussels sprouts, grapefruit, tomato juice, and cantaloupe. Vitamin D is essential for calcium absorption and, like most of us know, bone growth and remodeling. So this is different from vitamin C in a way. Our body is able to make vitamin D on its own. So sunlight triggers the synthesis of vitamin D within our bodies. So its role in immunity, it assists in activating immune cells and properly regulating their function. So the RDA for vitamin D, 19 to 70 years old, is 600 international units, whereas if you're over 70 years old, 800 international units. And I know the source, some people may be recommended to have higher dosages, but you want to be more so weary of vitamin D. You're more at risk for having a toxicity of vitamin D just because it is a fat-soluble vitamin. It's not like vitamin C where the waste is going to be excreted through your urine. So megadosing on this vitamin is, just be wary of doing that because you are at more risk for a toxicity of this vitamin. However, I know there are some people that their doctors do recommend having more than the RDA because they may be having fat malabsorption or some kind of medical issue going on where it requires them to have more. Vitamin C food sources. It's found in a lot of fatty fish, so cod liver oil, trout, salmon, mushrooms, and the other ones where vitamin D is naturally found is egg. It's found in the egg yolk, sardines, and liver, beef. So the three on here where vitamin D is fortified, fortified means that the food doesn't naturally contain that vitamin. It is fortified, so it is added to that food. So 2% milk, soy milk, and ready-to-eat cereal are also very good sources of vitamin D, but they are fortified. All right, zinc. So zinc is an essential mineral. It's very important for wound healing. It's needed for so its role in immunity is needed for cellular reproduction, which is important for the synthesis of new immune system cells. Research has also shown that zinc deficiency diminishes the capacity of the body to combat pathogens. This happens through weakening of innate and adaptive immune responses. So these zinc deficient individuals have an increased susceptibility to a variety of infectious agents. The RDA for zinc, 19 years or older, is 8 to 11 milligrams per day. These are food sources, so oysters being the highest, beef chuck roast, crab, lobster, chicken, pumpkin, yogurt, cashews, chickpeas, and instant oatmeal. So supplement use. Take supplements with food. Taking your supplement with food assists in improving the supplement's absorption. And I also wanted to bring up that the U.S. Food and Drug Administration, which is the FDA, is the regulator for supplements. They do not determine whether dietary supplements are effective before they are marketed, which is why advertised claims for some supplements may not be backed by scientific evidence. I wanted to bring this up because the FDA does regulate supplements, dietary supplements, and making sure that they're fit for human consumption and that they're not harmful, but they don't back up, it's not ensured that their marketing claims are what they say they're doing. So if the marketing claim for a dietary supplement says that your immune system is going to be supercharged, they're allowed to make that kind of marketing claim in order to sell their product. So just wanted to highlight that. Factors to consider when choosing supplements. So amount it provides, excess is not better, like we discussed, the quality of the supplement, research conducted and findings lending support to the health claims that the manufacturer of the supplement company is making. That's really a big one. Probiotics, for example, are not all the same. Different strains of bacteria have different effects. Personal factors, so medications. You are on different set of medications than many other people, so that makes it more personalized, not one size fits all. So what works for someone may not be the best choice for you. So all of these things stress the importance of consulting with your healthcare provider or a registered dietitian prior to beginning supplementation. And this is a great resource that I've found. It's frequently asked questions related to supplement use. So it addresses things such as how to get more info about a particular supplement and on its safety and effectiveness, and finding more info about the use of supplements in relation to particular diseases. So that's a really great resource in combination with consulting your healthcare provider about prior to beginning any supplementation. So conclusion, just wrapping up. Trying to emphasize nutrient-dense foods in your diet to help combat, help support, strengthen the immune system. How to be sure you're getting the most nutrients, vitamins and minerals your body needs. So by consuming a variety of food sources that are nutrient-dense to make sure you're getting all of those. As you can tell from our vitamin C, vitamin D, zinc food sources list, those were some differing foods. So you can't get all those vitamins from the same same type of foods. So nutrient-dense foods includes fruits, vegetables, whole grains, nuts, seeds, beans, leaner meats, and seafood. These will supply you with immune-supporting nutrients, as well as supplying your beneficial gut microbes with plenty of prebiotic fiber. So those high fiber sources that we talked about, those are that are loaded with prebiotic fiber. So you're knocking out two birds, one stone. So, and that's it for our presentation.